Good morning, everyone. Karibuni. Coming from a common history, in many ways, India and Kenya offer a strong prospect to showcase South-South collaboration. India has already great ties with Kenya in many sectors such as pharma, infra, and technology, and many more. So this is an opportune time to strengthen the relationship further. Standing here, I see a room full of opportunities, and I would like to state a quote here. If everyone is moving forward, then success takes care of itself.
There are some brilliant healthcare solutions which are not costly, that impact and affect lives in other parts of the world. Now, this kind of solutions can easily be brought into Africa and make a huge difference.
The journey so far has been great. The program got recognition globally last year. We won the P3 Impact Award, which is given by the State Department, Government of US. And that was a recognition of the collaborative effort that the program sees. And when I say collaboration, it's 100 plus stakeholders that work together to make something possible.
Healthcare, as Himanshu mentioned, is a social enterprise. We are actually creating a healthy workforce which contributes to the economic growth. We are creating healthy minds, healthy people, which contribute towards positive development of the country in the social aspect, in the political aspect. And therefore, it is our primary need. The new concept that India is launching, and we all have seen this, it is vital for all of us, is One Health, One World.
The way to increase revenue available for the Kenyan government is by increasing Kenya's local manufacturing industry. And that can only be done in partnership with Indian companies, with American companies, and promoting international but also local companies who are already doing this.
We want health to be available and affordable to all, and we want to avoid the hardships and impoverishment because of seeking health.
This forum represents an opportunity to be able to look at the challenges that are facing us here, not only in Kenya, whether it is in terms of limited resources, whether it is in terms of channeling them for being able to improve life expectancy, or even being able to allow a hub and spoke model to ultimately benefit even other countries, including Kenya.
So in the presence of esteemed guests, I would now also request Dr. Amit Thakkar and Mr. Himanshu Sikka to announce the collaboration between AHB and IPE Global.
Now to officially exchange this with IPE.
Healthcare enterprises in Kenya, despite having a large addressable market, still face challenges to scale up. This limits their ability to innovate, to manufacture, and to grow and serve the healthcare needs of the country. We believe that blended finance can play a pivotal role in addressing this financing gap in the healthcare sector.
One of the things that COVID has taught us is the need for development of local value chains, local manufacturing and such, and that requires financing.
So in your selection, the people who are going to fund those businesses down the road, they need to understand that this business has this risk, this is a growth curve, this is an opportunity, and this is where we can come in even to sustain the business model.
Healthcare is seen as a growth sector, so there's quite a bit of focus in terms of looking for transactions within that space.
When I go back to the first point about donor funding shrinking, we're also seeing from recent, ODA, Overseas Development Assistance reports, when you hear billions are available, just know that it's 50 to 70% of those funds that are actually mobilized. So not only are those funds shrinking, but the numbers that you're hearing right now are actually available at half, three-quarter of the amount. And so we really need these diverse sources.
With the support of IPE and USAID, this is back in 2021, when we had just started manufacturing. We were doing about 20 units a month, which was a very, very small pilot manufacturing setup is what we had. And from there, we wanted to be part of India's COVID mitigation efforts. This was in 2021, is when we approached IPE Global through the Samrit program, and to fund us to get to a point where we're able to set up a manufacturing facility which is compatible with ISO 13485, which is required for manufacturing of medical devices, and have a capacity of manufacturing from 20 units to 2,500 units per year. And we were able to establish that with the support of USAID, IPE Global under the Samrit program. Now that we have established the manufacturing facility, the next thing that we needed was working capital, because to achieve that scale, we really need a huge amount of money to fund our procurement cycles. So that's when we again reached out to IPE Global through Samrit to USAID to help us procure and kind of help us get this material in place.
So today I'm joined by a very distinguished panel of speakers and experts and industries of Captain. And one of the things that came out in the morning was that people don't know what opportunities are available in blended finance. Another thing that we don't know in healthcare innovation is we don't know what innovations have worked in settings similar to ours. Are we facilitating enough opportunities to share knowledge and learning across countries, across continents, and even cross-sector? Something that has worked in the agricultural sector, for instance, might provide a lot of use in the health sector. And the people in this room, it is up to us to make sure that those opportunities are availed to our fledgling innovations across this continent so that they can learn as much as they can and they can know where to get their funding.
The gentleman who sat in this seat before me talked about the before product entities, the ones that don't know how to open a bank account. People like I and Amit have been through that journey and are able to share experience and knowledge from within and without, so that the entities will have less risk and fewer problems to deal with, and they do not have to reinvent the wheel.
We need horizontal systems, right? We need to be able to be building systems that can deal with not just AIDS or malaria, but actually the really, really boring stuff. And I think this is what then loses the excitement, the value, because it's not like saying, I've eradicated malaria or I've done this. When we're talking about horizontal buildings, systems, we're talking about the boring bits, systems, processes, talent. It's not really going to get you great news coverage or excitement. But I think what we need to do is focus on those boring bits. How do we build the health systems with the Kenyan and African governments so that they're able to deal with things like COVID and other pandemics and other things?
At the moment, donors are now becoming choosy, and then we can't ignore the fact that they've been instrumental in setting up our health systems from the early 80s to the 90s. Coming to the 20s, they helped us scale interventions and programs. But they, at the moment, they are now funding ready to scale interventions and programs. So you compare all these, the domestic fiscal space, the lack of ability of the governments to raise enough revenues, and the shrinking donor funding, and this is a huge blow to us bridging our funding gaps. But there's hope to it, there's always solutions, there's always light at the end of the tunnel.
People like Convergence, some of the other people who have spoken here today as well, and the work that they're doing. I think there's a lot of buzz now around blended financing. Access Afia's model is one that relies on blended financing. I think there is no other way that health enterprises can grow through this next phase. And so we've deployed grants, equity, impact debt as well to finance growth. And really the crucible kind of point that we're looking at here is unlocking a scalable financing mechanism to grow the platform.
Now we are talking about instruments. We talked about the institutions, but the instruments are now being matured. Once the instruments are formed, I feel that Africa will share within Africa for Africa to rapidly increase intra-Africa trade, but also intra-Africa sharing of knowledge and collaboration.
When we talk about quality and affordable healthcare, that means where a person is shelling out $400 for an accurate diagnosing of the disease. With the help of Medini, the person is just shelling out a $7. We have cut down the quality and affordable healthcare to that particular level, where a person is not only getting the diagnosis and prognosis, but also getting the future disease prediction. That means we not only define your healthcare, the diseases you are suffering right now, but also with all those diseases which you could suffer in your upcoming 5 years. We believe preventive healthcare holds a very important part right now.
As rightly said by Nelson Mandela, everyone can rise above the circumstances and achieve success if they are dedicated to and passionate about what they do. While the road is little patchy, we have immense faith in the professionals who are present today to leapfrog and continue to strengthen health systems through innovative and collaborative approach. Together we can, together we will. As we embark on a new journey, we would like to extend special thanks to USAID, who has supported and guided us throughout this particular journey. Once again, thank you for your valuable contribution to this event, and we look forward to engage with you in the future. Last but not the least, we would like to thank the entire team at AHP and IPE Global for being able to put together this event. It definitely takes a village to put the pieces together at all levels to make an event successful.